A 45-year-old lady's leg was trapped by a train in Boston. Her legs was twisted and bloody with bones exposing through her thigh. But just when the people around her picked up their phones to call the ambulance, she cried to them, "Don't call ambulance. Do you know how much an ambulance costs? It's roughly 2,000 plus USD, which costs about 11,000 ringgit in Malaysia. Just for this, you want to take a wild guess? How much does it cost to call an ambulance in Malaysia?
Surprise me.
Well, it ranges from free to around 200 ringgit. So it's not that expensive, right? In fact, it's pretty cheap compared to the US especially. What about everything else? Like surgery, hospital, admission, medication? Why not? Let's ask some people. Hey, Frankie.
Oi.
You got kids, right? How much was it when your wife gave birth?
Oh, so long time ago. I think on average one person around 6,000.
6,000 ringgit natural birth, right? Guess how much is it if you want to give birth in the US?
$6,000.
$6,000? No. Higher?
Higher. 16,000.
No.
No, higher. Double. 32,000.
Yes. Non-complicated vaginal birth is about 30,000 USD onward. But if it is non-complicated C-sec, it's 50,000 USD.
Times 4. 200,000 ringgit.
The day you told me you've been admitted into hospital before, right?
Oh.
How much did it cost for you to stay in the hospital for one night? Just the room lah, room alone.
Roughly 200 bucks, 300 ringgit.
200-300 bucks, right? Guess if you are in the US and you need to stay in hospital just for accommodation one night, how much will it cost?
One night. Okay lah, same lah, 200 USD.
Wrong. Higher.
Higher. 300, 500.
I think about 2,000. Can go up to there lah, depending on state lah. But it's freaking expensive.
It's so freaking expensive. Why would you even want to admit at that point?
That's why! So why is it so expensive in the US? This is because they don't have universal healthcare. According to WHO, universal health coverage means that all people have access to healthcare services that they need without financial hardship. To simply put it, people don't need to mortgage their house just to pay for medical bills. Now, this should include a full range of essential health services. Actually, to think about it, it's quite weird, right? A first world country like US don't have universal healthcare when other countries like Europe, Canada and Australia all have adopted a universal healthcare for their citizens. Having a universal healthcare doesn't mean that all medications and all treatment are free, but it just means people are going to be paying a reasonable price for their healthcare, making healthcare affordable for everyone. Hello, even Malaysia, we also got universal healthcare. So what does it mean if you don't have universal healthcare? It simply means that there's no body to regulate the pricing of healthcare services. Therefore, private healthcare services providers like doctors, hospitals, pharmaceuticals and insurance can just hike up the price as they wish, which means this kind of thing will happen. Like many people say in the US, you are just one medical bill away from bankruptcy. Well, some people say it's because people themselves don't want universal basic healthcare because they don't want to pay more tax. Some say it's because of the healthcare industry is spending enormous amount of money to lobby for the prevention of universal healthcare so they can continue to raise up the price as they wish and maintain their growth of their revenue. On the other hand, let's talk about Malaysia. Malaysia's healthcare mainly fall under the purview of Ministry of Health. We have two-tier healthcare system consisting of both government-based universal healthcare system and a coexisting private healthcare system. That's why when you go to a government-based hospital, you'll realize that the price of medication and medical procedure is not expensive. This is because our government actually subsidizes 98% of the cost at all public facilities in the country. For example, think about the One Malaysia Clinic initiative where the cost of medication is usually cheap and the consultations are free. At least that's something good that came out of One Malaysia plan, right? If you go to government hospital today, some of the medications and treatments that are more expensive are no longer available for free anymore. But overall, it's still much cheaper compared to a private hospital lah. Because of this affordable or even free medical treatment, there is a huge number of patients that go to government hospitals to seek for treatment. On the other hand, there's also a significant shortage in the medical workforce compared to the number of patients that are seeking treatment. So this leads to a long queue in government hospital and many backlogs. This reminds me of an incident some years back. A friend of mine actually had a heart attack and was admitted to a government hospital in Petaling Jaya. After the diagnosis, the doctor told him that he has 3 blockages in his heart and he actually needs a bypass surgery as soon as possible. But the earliest date they can arrange for it is 6 months later because the hospital is just packed and many people are in the queue. And if in that 6 months he has a heart attack, he may die. It's kind of like a ticking time bomb. That's a pretty stressful thing to hear, right? By the way, it is not entirely free because he needs to buy some medical equipment and certain medications. It will still cost him about 10,000 ringgit. In the end, he chose to go to a private hospital, which cost him about 50 to 60,000 ringgit for the whole procedure. Although the cost is 5 to 6 times more than a government hospital, but the good thing is he didn't need to live with stress for the next 6 months and he's certain that he's gonna be fine. Oh yeah, by the way, do you guys want to take a wild guess how much does it cost to do a bypass surgery in US, New York City? The answer is 320,000 Malaysian ringgit. The point is, Malaysia's private healthcare system actually works quite well to complement our government's healthcare services. It certainly costs more than government, but it is not exorbitant and totally unaffordable. This is because in Malaysia, we actually have regulation to ensure the affordability of private healthcare. So yes, doctors and specialists in Malaysia actually have a maximum allowable professional fee that they can charge to their patient. However, there are some other areas that lack the regulation in terms of medical costs, such as accommodation, laboratory tests, use of equipment, and nursing care. These items can also easily lead up to a high medical bill if it goes out of control. Because when you go hospital, it's not just the doctor's fee lah, everything else must include ma. It is the price increase of these items that has been contributing to the high inflation over the past few years. Do you know it is said that Malaysia's medical inflation is around 10 to 15% a year? Don't forget, as all these medical costs rise, insurance company will also need to adjust their costs, and this will lead to premium increase. So you as a policy holder, you will see your insurance premium price need to be adjusted every few years or so. Anyway, in order to ensure that affordable healthcare system in Malaysia maintains, all the relevant parties in our healthcare system have to work closely together. Talking about global ranking, in 2021, Malaysia is ranked 44th globally in terms of healthcare with a healthcare index score of 77 out of 100. That is not bad, right? But if you look at UK, ranked 31st. So we are not that far from UK. In terms of US, 68. So we are much better than US. So government, I have to say, not bad lah, not bad. Actually, we are not that one. If you compare Malaysia's healthcare standing to the rest of Southeast Asia, we are ranking number 3, okay? Only after Thailand and Singapore. Talking about Thailand and Singapore, why are they ahead of us to a certain extent? One of the reasons is because they both have one thing in common, which is their focus on medical tourism, where the cost of procedure are usually much cheaper compared to those in US and Europe. But having said that, Malaysia is also currently getting more popular as a medical tourism destination, which means that people from overseas actually come to Malaysia for medical treatment. For example, in Malaysia, we are renowned to be a provider of specialized treatment for fertility and cardiology treatment that comes with a reasonable price. So why is it cheap? It's because of this. It's actually because our labor cost is quite cheap lah. It is not our frontliners, our doctors are not good. If anything, our top surgeons and doctors are actually well known and they are certified, highly trained in developed countries too. It's just that we don't pay our doctors too well. In my opinion, I think that we should really be paying our doctors and nurses more because they are the front line and they do deserve more, you know? Especially during the last 2 years, they took such a risk to treat patients and putting themselves in front of all these diseases and so on. They took their responsibility with such grace and honor, and that itself deserves recognition. Another improvement that can be made is government's contract system in appointing medical officials. And just last year, we saw medical officers actually going out on a strike known as Hatau Doctor Contract to protest for that system. The main problem that was raised was the fate of government medical officers after expiration of their 5-year contract. What are they gonna do when their contract ends? There was no clear policy for the absorption of these medical officers into permanent positions, nor opportunities to pursue their studies to become medical specialists. In fact, it was because of these things that I actually have quite many friends who refuse to come back to Malaysia even though they are very good doctors. And it's no wonder that our brightest doctors and nurses are thinking about leaving the country. I really hope that our government can find a long-term solution to these problems and continue to provide us people with a good healthcare system. But if you're talking about healthcare, I bet some of you who have insurance will be wondering what are the things that are covered and not covered. Will insurance reject my claim if I want to claim? If you want to find out more, go and check out this video.